Like every other episode in this series, you can watch this one for free. Let me also ask you to consider supporting our mission by choosing to own the series. Help us to spread the truth to those who need it most by clicking the link below. Change your life or the life of someone you love by making the Broken Brain docuseries yours today. Thanks for watching. Let's dig in. After years of ignoring the science, we finally are beginning to have a nationwide conversation about the impact of traumatic brain injury. Injuring your brain through playing sports, falling down, or getting into an accident is not a small matter. Traumatic brain injuries can have a far deeper impact on our overall health than we ever imagined. But even though there is more awareness than ever about the risk of traumatic brain injury, the truth is the recommended solutions aren't always grounded in the latest research. If you or someone you know is suffering from a brain injury, is there anything you can do about it? Your doctor might tell you just to rest, but you might be surprised to know that there is so much more you can do to support your brain during recovery. In this episode, our experts will talk about their personal experience with traumatic brain injury and what they did to reclaim their vitality and the vitality of the ones they love.
So when my son was 16, he was crossing the street and he was hit by a car. We estimate maybe 40 miles an hour, though no one saw it happen. And he was literally left for dead in the street. The woman got out of her car, gasped, and drove off. And thankfully, a neighbor pulled up, called 911, and he was airlifted to the local hospital. When we got there, the doctors told us that we needed to let him go. He had a torn aorta, which kills 90% of the people on the scene, and it had to be repaired, but the challenge was they couldn't repair it at that hospital because he had a severe traumatic brain injury. And in order to fix it, they had to do it without a blood thinner. So they had to airlift him to another hospital, and the doctor said he would never survive another airlift. And even if he did, he wouldn't survive the surgery. And even if he were managing to survive both those things, the chance he'd ever be normal was minuscule. And my then 15-year-old son looked at that doctor and said, so maybe like a 0.25% chance he'd make it. And the doctor said, that sounds about right. And he goes, we'll take those odds. And any parent watching this, I think, would say, hey, I'm gonna fight, right? I'm gonna fight for my son's life. So we get to the next hospital. He survives the airlift. We have an amazing surgical team, 5 different surgical teams working on him. He survives the surgery, and then he is in a deep coma. And the neurosurgical team says, we don't know if he'll ever wake up. We have no idea if he does, what his life will be like. And I remember standing there hearing this and holding my son's hand and telling him, and there were like 2 fingers I could hold. Everything else was either bandaged or covered with road rash. He had 13 fractures, bones literally sticking through his skin. And I said, Grant, this is going to be the best thing that ever happened to you, which is a ridiculous thing to say. I mean, this was looking so bleak, but I had to have hope. And I said, you're going to be 110%. And from that point, I was scared to death. I mean, this was like the worst thing a parent could ever face. Immediately, I put an SOS out to all my friends on Facebook, and I had incredible help coming into the hospital early on. I had Dr. Hyla Cass coming in right away, Dr. Daniel Amen, and so we were able to kind of start to do some things that you wouldn't normally get to do, and that the hospital actually wouldn't let us do, but we did sort of circuitously, that I really believe are the reason that he's not only here today, but he's actually 110%.
We've gone from a state where mainstream medicine has, for decades, said to people who have a traumatic brain injury that if you have a concussion or a mild traumatic brain injury, you wait a number of weeks and 80% of you will get better, but 20% don't. And for those who don't get better, what we said they should do is just rest, or rest and restore, or rest and pray that they restore.
Rest and pray, that's a good medical prescription.
So the patients that got better were fine, but there are many, many patients out there who haven't gotten better. In fact, traumatic brain injury is the #1 cause of combined death and disability in America if you put them both together, and it often affects young people too.
Well, the conventional approach is basically if someone, hits their head, as a kid or an adult, let's say it's a kid, because I have a lot of compassion for children that hit their heads. So they usually go to the children's hospital in their area. They're seen by an emergency room doctor or someone like that, and they basically just tell them, they try to determine if they could have a bleed in their brain, and then they often will do a CAT scan. The CAT scan often doesn't show very much or doesn't show anything, and then they tell them to go home and often tell them not to go to sleep or make sure you can wake this person up every couple hours. And so these people get completely exhausted or sleep deprived, and then they basically tell them about what symptoms they could have called post-concussion symptoms. And then they have some follow-up with a neurologist possibly, and then the neurologist, if they don't find any really gross, really bad things on the exam, that's it. And these people might actually have headaches, dizziness, brain fog, the kids or the adults have all kinds of symptoms, and then they might go to a primary care provider. If they're a kid, go to the pediatrician, otherwise go to their adult doctor, and they just don't have an approach to it because they don't have something they can match to it, like, okay, you need this drug. There's no drug for it, really. And so sometimes they're sent to a speech therapist if they're having problems with speech, or if they're having problems with memory. But there's only a certain percentage of speech therapists that are actually trained to do much work with what we call cognitive rehab. They're almost never put on any vitamins or supplements at all. They're almost never given any advice regarding exercise. So the conventional approach really is very deficient and will often leave people with cognitive deficits or what we call a decline in brain reserve, because we all have a certain amount of brain reserve, whether we're a kid or adult. But if there's brain injury and if it's not taken care of appropriately, then the person's brain reserve can go down. And if it goes down enough, they'll start having symptoms. So the conventional approach is very, very limited, and I'm very concerned about it. And that's even true in the NFL, with National Football League. I mean, the conventional approach there is more like, do initial testing on the field and on the sideline, determine whether the person can go back in, make sure that someone doesn't go back in when they still have any type of cognitive problems, because there's something called the second impact syndrome where the brain can go through a part of the skull and the person can die. So it's the approach in the NFL is much more sort of, let's make sure you don't have a second impact syndrome, as opposed to healing the brain. One thing a lot of doctors don't realize is there's a lot of people that have hit their head or had a head injury, and they just don't even find out about it. So a doctor needs to ask questions like, have you ever hit your head? Have you ever fallen down and hit your head? Have you ever fallen off a horse or a mountain bike? Have you ever hit your head while you were skiing? And oftentimes people say, yeah. Like someone can be in a motor vehicle accident and they can have enough force so that their head moves back and forth and their brain moves inside their skull, and they can actually have a traumatic brain injury without actually hitting their head, like hitting their head on the steering wheel or the windshield or something like that. And so then, getting some more information like, how did it happen and what the forces were. Like I had a personal experience that I can talk about later in a mountain bike accident, and the forces were pretty significant. What kind of protective gear were you wearing? That actually affects the head injury. Basically what I did was I've been treating head injuries for a long time, and I get head injuries referred to me from the local emergency room and from other doctors, chiropractors, other doctors. And I decided that an approach needs to happen, which is figuring out what stage of the head injury, like acute, like the first week, the first few days, and figuring out, okay, is there anything serious going on? Like real brain damage, severe brain damage. And then figuring out what stage they're in and what's going on in that stage. For instance, it's been found that even in football players, if they draw their blood within 1 or 2 hours of slamming their head, they can start having antibodies to their own blood-brain barrier. And so one of the things that I'll frequently do is get a blood test to see if this person has antibodies to their own blood-brain barrier, because the blood-brain barrier is supposed to keep things out of the brain. And if it's increasingly permeable, it will let toxins in the brain and things in the brain that just shouldn't be getting in there that can damage the brain. So one of the functional medicine approaches that I've developed is assessing whether the blood-brain barrier has been damaged or there can actually be antibodies to the blood-brain barrier, and then having a treatment program to heal the blood-brain barrier.
The American Soccer Association just came out and said, if you're under 11, you cannot hit soccer balls with your head, right? Because they realized it's associated with long-term brain damage. You don't like 12-year-olds? 13-year-olds, 14-year-olds, the brain's not finished developing until you're 25. So it's like, seriously? Or we engage in high-risk behaviors. So we need to have more love, more respect for the brain. So protect it.
I've had many head injuries, traumatic brain injuries, head traumas. And so how do you overcome that and how do you fix that? You wear a helmet, right? You avoid extreme sports, right? Because your brain is very resilient, but it's also very fragile. So brain protection, protect your brain.
A lot of sports, a lot of contact sports, there definitely needs to be a lot more precautions. There needs to be a lot more awareness and education about not just with traumatic brain injuries, but also what subsequent problems can occur from it. I have a lot of patients that will come in and say, I'm a football player, this is, my passion, I love it, or, skiing or surfing. And the very first thing I'm gonna say is, well, use safety precautions, wear a helmet, and I will educate them, because if not, this is what can happen. You can have damaging, consequences to it. So am I gonna take away, a thriving football player's passion, or am I going to look at the entire, risk and look at their benefits and educate them and tell them, you know what? Well, let's look at prevention. Prevention is, to wear a helmet, try not to get tackled, not slaughtered on the field, and basically then let's reassess if something does happen. How bad was your brain injury? Did you have a concussion? But I also like to look at everything from a holistic standpoint. And if someone is very happy and passionate about playing football, I'm not going to take away and say, no, don't, get their parents and everyone on board, don't play football because you enjoy it. You always have to look at things from a risk-benefit ratio. And then I think educate, inform your patients, and then keep reassessing and going step by step based on their lifestyle and what makes them happy, and also what are some things we can do to prevent traumatic brain injuries.
As with any condition, optimizing nutrition can be a powerful intervention when treating traumatic brain injury.
Then, in terms of the functional medicine approach that I've developed, it's looking at, okay, is there a lot of neural inflammation? And there almost always is. So how do we find the sources of neural inflammation, like in the GI tract in the gut, and actually treat the gut when we're concerned about the brain, and then also treat the brain? Like there are some things that can actually pass into the brain, like there's a form of curcumin that passes in the brain better than some other forms that can actually decrease neural inflammation, and there's some other things that can do it too. And then we want to look at what stage they're at, because there could be all this congestion in the brain, and then we want to think at some point, okay, do we need to stimulate nerve stem cells, like new nerve cells? How do we do that? How do we create brain-derived nerve growth factor? How do we increase it to get more nerve stem cells going? How do we increase synaptic connections in the brain? Because that's the thing that helps create memory, and that's the thing that's going to help learning. So I've sort of devised a program that incorporates the right supplements to do these things based on the research, as well as brain training, because brain training is the main thing that will create the synaptic connections, as well as incorporating exercise to increase brain-derived nerve growth factor, as well as using some modalities like frequency-specific microcurrent that is applied that can actually heal areas of the brain, and also other things, because when someone has a brain injury, the hormones can be affected. So that I want to look at all the hormone levels and make sure they're tuned up, because sometimes the actual pituitary gets damaged, and all the output from the pituitary can go down, and the person may not have the hormones that they need. So that has to be addressed. And then stress management is extremely important, because often people are very stressed after this type of injury. And then it's important to treat the pain that they have, because the pain can drive cortisol levels up and cause all kinds of problems. And oftentimes there's a head injury and neck injuries and musculoskeletal injuries at the same time that need to be treated, so they're not in constant pain. So that's a long answer, and there's a lot more detail to it. One of the things that's really important after any kind of head injury, whether a kid, slips skiing or falls off their bike, or an adult falls off a horse, or whatever it is, or an auto accident, is we want to decrease inflammation in the diet. And how do you do that? Well, you decrease fried foods and breaded foods and eliminate all trans fats in the diet. And also sort of have people eat like a low glycemic index diet, where they're not eating a lot of starches and breads. But there's some other things that they can do. They should go on a gluten-free diet, even if they don't have antibodies to gluten, because there's information that some of the molecules in gluten can create an autoimmune process in the brain if the blood-brain barrier is having a problem. There are some molecular sequences in gluten and in dairy that can damage the brain after a brain injury, so everybody needs to go on a completely dairy-free, gluten-free diet for about 8 weeks. I always say about 8 to 10 weeks is what's called the critical period after a brain injury, when we need to do this kind of dietary intervention in a big way. But there's a lot of these things you can still do after that period. And then I put everybody on omega-3 fats, especially the DHA part of it. With kids, they won't take capsules. So there's some liquid forms of DHA, fish oils that taste like lemon or mango. And so I know which brands these are, and I just tell the parents to give these kids like a teaspoon to a tablespoon twice a day, and that will get them the fatty acids that they need.
My patient with post-concussion syndrome, it was horrible. She was a student of mine, actually, and she had suffered a traumatic brain injury. And she developed bilateral subdural hematoma, which is bleeding in the brain. And because of that, she was in the midst of medical school. She could no longer do what she had set out to do, to become a doctor. And so she had brain fog, she had balance problems, she had headaches. And when she tried to study and read, she'd just get really tired and just would crash out. And so I did the workup, and in my experience, a lot of those patients, a lot of patients with concussion, they respond really well to what's known as a ketogenic diet. And that looks at higher fat, but healthy fats, middle moderate protein, meat and things like that, and really low carbs.
And then I put everybody on wild blueberries. And what's really interesting is that there are biochemicals in blueberries that help heal the brain after brain injury, that are even also good if someone wants to prevent dementia and other things. But wild blueberries have this purple pigment. And what's funny is if you're ever, unwrapping a pack of wild blueberries and you get some on your fingers, it stains your fingers purple because of this pigment in there is so strong. But wild blueberries have many times that pigment than a regular blueberry, because what's really interesting is the more stressed out the plant is, the more of this protective pigment it produces. So these wild blueberries are often from Canada and some other places, Vermont and New Hampshire, different places where they can get wild blueberries, and I have people mix a third of a cup, something like that, fourth to a third of a cup, and create a protein smoothie with them twice a day, because I want a lot of this. They're called anthocyanins. They're a certain type of phytochemical, and they're a pigment that helps heal the blood-brain barrier in the brain. So I put everybody on these blueberries. And of course, if they want to eat blueberries, they can eat blueberries. But I have them go to places like Trader Joe's and Whole Foods that have these in bulk, the wild blueberries in bulk, and then just, mix them in their smoothies or put them on, foods like oatmeal or other things. But I often want them to put protein in their smoothies too, a little bit, but not dairy, because I don't necessarily want them to getting a sugar rush with these blueberries. want them getting some protein too. And so, if you're doing this with kids, if I'm doing this with kids, the kids actually like it because they get smoothies twice a day and they're getting this flavored fish oil. But adults seem to like it too because it tastes good. And it's a basic way that people can eat. I mean, I also put them on a regular diet of like a lot of cruciferous vegetables, and just a really healthy diet in general. Like if they're going to eat meat, grass-fed meat. So an anti-inflammatory diet, high in certain phytochemicals, high in omega-3s to help heal the brain.
If you're finding this series to be helpful, help us spread the message and continue our mission by sharing this docuseries with your friends and loved ones. You can do this by clicking the link below. When treating traumatic brain injury, it's important to consider alternative therapies such as hyperbaric oxygen and neurofeedback.
SPECT is a nuclear medicine technology. It's a functional brain imaging in that it determines the activity in the brain. What it does, it tests the blood flow in the brain. And based on the blood flow in the brain, we consider metabolic activity. So the theory is that those areas of the brain that are working well, those areas demand more oxygen and nutrients. So the blood flow is higher to those areas. And those areas that are lazy, damaged, inflamed, or not working well, those areas do not demand that much oxygen and nutrients, so the blood flow is lower to those areas. So what we do is we give you an isotope. The isotope is a radioactive isotope called Ceratec, and it kind of flows with the blood, goes to the brain, and then gets absorbed by the brain cells, gets fixated in the mitochondria, and under the camera, it lights up. Those areas of the brain that are working too much will absorb most of the isotope. Those areas that are lazy or damaged will not absorb the isotope. And those areas that don't absorb the isotope, it looks like a hole or a dark area. And so based on the different activity patterns throughout our practice, we have learned to apply that into the diagnostic criteria of the patients. The majority of the cases, we see a decreased perfusion in the prefrontal cortex area of the brain. The prefrontal cortex is right above the eye socket. It's right the front part of the brain, which is the executive functioning of the brain. And so in a normal setting, you should have normal activity. We don't see any kind of a deactivation in that area. But in cases of traumatic brain injury or in cases of ADHD, in 70% of the cases, we see a deactivation in the prefrontal cortex area. So that deactivation by itself means that the executive function area of the brain is not working well. This is the area that we call as a braking mechanism of the brain, where it tells you not to do this and allows you to do, certain activities. So that braking mechanism is impaired, meaning that the individual will be impulsive, hyperactive, and will have very limited control on his or her behavior. So that's the prefrontal cortex, and when we see decreased activity in the prefrontal cortex, the treatment approach will be more towards stimulating the prefrontal cortex area. But at times we see that the brain already is overstimulated, especially we see cases where the limbic system, the basal ganglia, limbic system, and basal ganglia is basically the alarm center of the brain. It usually, when it's overactive, it indicates mostly anxiety, and the limbic system, when it's overactive, indicates more a mood disorder. So, when we see that type of activity, we pay more attention to the mood component or the anxiety component and target our treatment more first towards that type of treatment where you treat the anxiety and the mood first and then consider other areas. PECT has been used for 25, 30 years. I mean, the case studies in the 90s, there were a lot of case studies that, I think Lou et al. Has, Zeke et al. Has, Dr. Heyman has a lot of studies. There's another guy, Put et al. He has done a lot of his work on traumatic brain injury. I'm especially very fascinated with the traumatic brain injury and application of SPECT in mild to moderate traumatic brain injuries. You see, in mild to moderate traumatic brain injury, you cannot determine the extent of the damage by doing an MRI or a scan, a regular scan like a CAT scan. Those are structural brain imaging, and in structural brain imaging, you cannot see the impairment. We did a study on the NFL players, and these were NFL players that had significant traumatic brain injuries. And they came in, we did a SPECT scan, we developed a protocol of treatment, we treated them, and then we did a ReSPECT on them. And there was a significant improvement from baseline to post-treatment. In cases of traumatic brain injury, we consider hyperbaric oxygen treatment, and we also consider natural supplements. That's the first step of treatment, is that almost always we try to consider natural supplements. In cases that are more severe and refractory to treatment, we almost always get those type of cases where patients have not responded, and at the end point they come into the clinic. And so at that time we are a little bit more aggressive in our treatment, so we consider medication. In cases of depression or anxiety, we consider transmagnetic stimulation.
Hyperbaric oxygen is where you give oxygen at a higher percentage. You know, what we're breathing is 21% oxygen. And so depending on the unit, you can give anywhere from concentrated oxygen, which is like 28 to 35%, to up to 100% oxygen. But more importantly, you give it at an increased pressure. So you help that oxygen to get into the cells and decrease the inflammation, and also improve the mitochondrial function, because that's something else that's affected in a lot of our kids. The mitochondria are the energy cells of all of our body. And so when our energy cells are not working, our energy is dysregulated.
Hyperbaric oxygen can be a good treatment after a head injury, especially within the first 12 weeks, but it can also be used after that. It's usually used in groups of 10 to 20 treatments at like 1.3 to 1.5 atmospheres. It's kind of a commitment on the part of a person or a family, because people are going like 5 days a week. Hyperbaric oxygen increases the oxygenation level in the brain. And one of the theories is that there's some decrease in oxygenation in the brain because of the damage to blood vessels and the decreased ability to get oxygen in the brain. Oxygen functions in cells to help create energy. That's one of the biggest ways it functions. So what I would say is, I don't recommend hyperbaric oxygen to everybody, but if it's a more moderate injury, or if they're really having some significant symptoms, I'll say, you know, you can do this. And it's probably a good idea, because studies show that it can help, can be effective.
I had this one veteran who was formerly with MI6 in England. He had fallen off a tank and hit his head, and he couldn't walk or talk for 9 months. He did rehab and recovered. He then had a horrible experience with PTSD because his best friend was shot next to him in the head when he was in the Falklands. He was a very resilient guy, though, and he came to the United States. He worked for the CIA, the FBI, and he was teaching special ops at the Air Force Base near me. He was at the top of a staircase, and the next thing he knew, he had fallen, and he was in the hospital. Something happened here that was different with this traumatic brain injury. He went into his daughter's room, and he was tearing up everything in her room, just destroying everything. He got very fearful that he would hurt somebody. He started crying. He would leave the house. So his wife called me in desperation. And so I said, well, just come in. So of course, we did an MRI to make sure there was no gross problems. And what I did for him, because I couldn't do an elimination diet at that time, but I wanted to sort of calm down his gut, I gave him a meditation to learn. And I had to settle down his brain a little bit with some Lamictal, which is an anesthesia drug, so that it could be calm enough to try to take on some of the things I was going to ask him to do. And after that, we did Loretta neurofeedback on him. And after 13 sessions, he's back to normal, and he is no longer on the Lamictal and doing very well. So we've now since put him on an elimination diet, and he's lost about 30 pounds and feeling much better, and look at, again, all the things we do with functional medicine. But I think that neurofeedback is going to probably be the one thing in psychiatry that's going to change the way we approach what we do. The way that we talk about it is in terms of operant conditioning. So what is that? Basically, it started because Sternman had this cat. This is one of the researchers who did this originally, and had an electrode in the cat's head. And there was this traditional thing where the cat would hit a bar and food would come out. Well, he paired a noise with that. And so the cat knew as long as the noise was on, if he hit the bar, nothing was going to come out. So he would sit there very still. And he observed through the electrode that when he was sitting still and focused, this certain brainwave pattern came up, which was interesting to him because it was a 12 to 15 hertz brainwave pattern that basically kept him very still and focused. And so he wanted to see if he could get the cat to produce that brainwave pattern on his own without the noise. And lo and behold, the cat learned how to produce the brainwave on his own so the food would be delivered. Well, that's actually what we're doing in neurofeedback. We put on a 19-channel cap, which has several electrodes on it, and we will record the brain, all the brainwave patterns, with eyes closed and eyes open. And then we'll compare it to a normal database. So, for instance, in what happened with the veteran who came in with PTSD and traumatic brain injury, we targeted the areas of the brain that we knew would be abnormal for those conditions, the symptoms that would be abnormal for those conditions. And then when he came back in, we decided we were going to just program it to look at those areas. And he would look at a car on a racetrack, for instance. And every time the right brain wave occurred by chance, the car would move. So the brain gets excited and goes, oh my gosh, where did that come from? And so it looks for it again. And eventually the patient is learning how to make that car move. Once they've done that, we can extend the amount of time that they're holding it until the brainwave patterns go back to normal.
The power of using all of the interventions described by our experts was powerfully exhibited when my friend J.J. Virgin devised a plan to treat her son's dramatic and traumatic brain injury. Grant's recovery is an incredible story of hope, determination, and the power of functional medicine.
So right away, the very first thing that I did was I started taking things to help me with stress. So I started doing some stuff to support myself because I knew that in order to show up for my son in the hospital, I couldn't get sick. He was in the ICU, and we had to go in there fully gowned and masked and gloved. So I made sure I put my self-care first, and I think that's so important for every parent here because we tend to put ourselves last. And I knew if I was making life or death decisions, I had to be totally focused and game on. Then one of the first things that we were able to do was use essential oils, and it wasn't something I was remotely familiar with. Someone came in and started using them with him, and all I knew was that for the first time I started to see some response from him. He wiggled his nose, he wiggled his fingers, which gave me some hope. We started using progesterone cream, which we were able to rub on him because it was a cream. And there was some research out of Emory by Dr. Donald Stein showing that it helps reduce inflammation, which is the big thing that you've got to do right now as your brain is just so inflamed. He looked like the Incredible Hulk in the middle of the pediatric ICU. You'd walk in and he was so blown up from all the swelling from 13 fractures and all of the road rash. But then the next thing that I wanted to do, and this is where it became quite a challenge, was he'd been on 5 grams of fish oil prior to the accident. And I'm on a mission to get everybody on fish oil because I know that one of the reasons he's actually with us today was because his brain was protected going into this, because fish oil protects your brain from injury. He was bleeding and they were afraid that the fish oil was going to increase his bleed time, and so they didn't want to do it. And I got them to go to 2 grams, but I knew we needed to be much higher than that. The doses that they do in this situation is anywhere from 10 to 20 grams. And I brought them all the research. Dr. Barry Sears actually sent it to me, and I had Dr. Michael Lewis, who wrote When Brains Collide, helping me with this, and I had all the research, and they go, nope, we won't do it. It's going to cause increased bleeding, even though there was nothing to show it would. So when he spit out his feeding tube, which he did himself, we started doing it ourselves. So first I got him up to 5 grams, and we would always do it right around when they were going to test his bleeding time, so I could check that. And we never saw any change in his bleeding time. We got him up to 10 grams at the first hospital, and then when we went to the second hospital, we got him up to 20 grams. And it was very interesting because as we increased his fish oil, when I went to the higher dose fish oil, he went from barely speaking to speaking in sentences. This hasn't been an easy path. He's been suicidal multiple times, which 25% of people with brain injuries are suicidal. This is a major problem out there. We tend to think of it as something that happens to our soldiers or football players, but it happens because of domestic violence. It's a leading cause of death in children. It's 1.7 million people a year getting a traumatic brain injury. This is a major problem. Over 5 million people are disabled at any time in the U.S. with it. And you can turn it around, and you can turn it around anytime. If you hurt your head 5 years ago, you can still massively improve it, but it's got to start with asking the right questions. So for me, it was, how do I get my son to be 110%? And then looking at every single thing that's out there that I could bring in to help him. And, I was looking in preparing for this of like, what did we do? And it's this huge long list of things. Now within that, I can tell you the things that were most successful for us, but that's us. It may be different for someone else, but it's asking that right question that made all the difference. My son, prior to this, early on had bipolar disorder. He still has bipolar disorder, but that led me down the path in the first place, and ultimately probably saved his life because he was on high-dose fish oil to start with that we'd done for the bipolar disorder. Here's the thing, we've all got something. Everybody does. Everybody's got something. I look at some of these things and I go, what if his bipolar disorder is actually an advantage? What if ADD is actually an advantage? What if there are things about that are going to be their advantages, and we can, deal with the rest? The first things that I think we need to always start with are cleaning up the diet and helping the gut as much as possible, because there's so much that we can do that make a major difference. And even if it only made a 10 or 20% difference, hey, that matters. And so whether you are a parent with a child with ADD or autism or bipolar disorder, or whether everyone's totally what we'd call normal, which I don't know what normal is, you actually still want to do all the same things. Eat a diet that helps you maintain good blood sugar control and blood sugar balance. Eat good healthy fats that help nourish the brain and reduce the inflammation. Exercise, because if you look at the one thing that's probably the most key thing for having a healthy brain, my gosh, exercise is so key for that. Now the research for that is all done on aerobic exercise, but I like to do aerobic exercise in the form of high-intensity interval training, and I think that I've seen some studies now showing that actually just gets you those effects faster and more intensely, and that makes sense to me because high-intensity interval training gets all of the good from aerobic training and takes out the bad. When you do endurance-style training, you create more oxidative stress. You're breathing heavier over an extended period of time, and you create stress on your body, and you lower your immune system. You can still get the benefits of what you would with aerobic training, which is all the blood flow and lowering blood pressure and blood flow to the brain with high-intensity interval training, but you train your sympathetic nervous system to handle stress better because you go hard and then easy and hard and then easy. When you do that, you actually raise growth hormone, you raise anabolic hormones, you don't have the oxidative stress that you had from the other exercise, you don't impact your immune system like you did with the other exercise, and the key most important thing about it is that it doesn't take much time. And I started out in this world as a personal trainer 30 years ago, and the number one reason people didn't exercise is because they didn't have time. And back then we used to tell them that you had to do it for at least 30 minutes or it didn't matter, which is ridiculous. But the second reason was they didn't want to go to the gym. And so this is something you can do anywhere, and you don't need a gym. So that's, to me, the foundation for exercise is to do aerobic training in the form of high-intensity interval training. And again, because of the blood flow, because of the impact that it does to all of the great brain chemicals, and because it really gets, it also increases your brain volume, it increases your growth factors, so it gets everything growing, moving, and communicating in your brain. So it was interesting, when Grant was in the hospital at Children's Hospital, LA, they had such an amazing program, and one of the first things they started to do with him was take him into this gym. He was still in a wheelchair at the time because he had a crushed heel, and there were things that we found that we could do. You can use bands, you can use balls. So I would say look for whatever you can do if you can get the person in a pool. We had Grant early on when we got him out on furlough. We took him to the pool and we put him in there and he swam completely coordinated. It was amazing. Things he couldn't do yet on land, he could do in the pool. So what I always say is always look for the way, and if there is no way to do that, then the next level would be to go to meditation. It was really difficult to get him out into any kind of social situation, yet he needed that. Isolation was really damaging. It's damaging to everyone. There was a study that showed that social isolation is more damaging than smoking 15 cigarettes a day. So he needed that connection, but it would trigger him. And what meditation does for him is actually calm down that amygdala, get him out of flight and fight. So he now can tell when he's getting there, and he goes into his room and meditates. As someone comes out of a brain injury, here's what I was told. I was told when he comes out of this brain injury, it's gonna be ugly. Now, I'd never been around this. All I'd seen was television shows where people wake up and they go, oh, I love you, hi. I thought Grant would wake up out of his coma, just open his eyes, look at me and say, hi, Mom. That's what I thought. I did not think that he would open his eyes, stare off into space, and move his arm repetitively for days on end. He didn't talk. He couldn't make any eye contact, nothing. He came out of a coma over time. But as he started to become more aware, he started to become super agitated. And I would see this little thing coming up here. And it was like the Incredible Hulk starting to turn green. And when it did, we had to shoot him basically with tranquilizers to keep him from going berserk. When I first walked into the hospital when he was starting to get like this, he actually was in a straitjacket. And that's when I knew, I was like, okay, we have to do something here. This is not how he's gonna get better. And so one of the things that happens as someone comes out of a brain injury is they are in that flight or fight. That's the first thing that starts to wake up. And it's happened to us now repeatedly because we've been doing stem cell injections into a spine. And when we do them, that's the first thing that comes back up online, is that comes up more. And what it does is it's like you lose your filter. You're gonna say or do whatever you think. If you think someone's attacking you, you'll hit them. If you feel like you're scared, you'll yell. And that doesn't work in society very well. So what he's done to counteract that is meditation and learning how to control his brain back. That combined with he's been doing neurofeedback. And that's helped a lot too, because now he can recognize when it's coming and he knows what to do. You look at anything. I come from the weight loss world, and while there's never one diet that's perfect for everybody, that's why I always look at this whole thing, like the current fight over all this stuff. I'm like, okay, there isn't one diet for everybody. And, when you have a brain injury, it's like, what's the extent of the brain injury? Was this the first brain injury? Was it a vibration brain injury? Was it a hard hit? What else was going on? With Grant, as he was waking up, we knew that I had a son with bipolar disorder waking up, which bipolar brains are less stable brains to begin with. Brain injuries are unstable brains. I was like, who's going to wake up here? We didn't really know. And so there was things specific that we needed to do there to really help stabilize his brain. CBD has been an amazing thing for him. But when you look at it, there's still common factors for everybody that we can look at. Number one, you must reduce the inflammation. So what things are going to be key there? That's where, like, if I could pull out my key most favorite things, fish oil, of course, would be the number one. Exercise, CBD, besides helping with brain stability, it also helps with reducing inflammation. And then curcumin. So those were some of the key things that we started to do there. And then you've got to stabilize the brain. And in fact, we've had them on medications to start with because that is so key. They can go into seizures. But ketogenic diet has been a key player here to help, and MCT oil. So what things I always looked at and went, okay, what were the pathways? How do we get them off the medication as quickly as possible? And then what things could we do diet-wise there? So we've got to do stuff to help stabilize the brain quickly. Ketogenic diets have been used for decades for seizures. So that's another one, and MCT oil there to help. And then inflammation and stabilizing the brain and balancing your blood sugar is another key one. And then, of course, getting the blood flow to the brain. So we were doing ginkgo. Fish oil is going to help there with cell membrane fluidity, and exercise is key. And recovery and rest. When he first was coming out of the brain injury, it was like raising a really big baby. It reminded me of when he was, 6 months old. He just was now 150 pounds and 6 feet tall. And he needed to get stimulated and then rest, and stimulated and then rest. So he was sleeping, about 18 hours out of the day. And he would sleep throughout the night, and then throughout the day we would go and stress him and then let him recover, and stress him and recover. And so that's another key thing that you have to look at with the brain injury, is really giving adequate rest and recovery. The most important thing that I've seen with Grant is that it's never too late, and there's always something else that you can do. When Grant was going through this process, there was a bit there where he was really suicidal, and he was like, I don't know why I'm here, I don't know what my point is. And I said, Grant, your purpose is to show people what's possible. My son was basically dead on the street. The doctors told us to let him die. They didn't think he'd ever wake up. They didn't think he'd ever walk. They didn't think he'd ever hear. And he's now better than he was before the accident. And he'll continue to get better. And now he knows that his purpose is to show people what's possible. The biggest limiter to what's possible is our mindset that tells us we can't do it. But if you flip that around and go, okay, what do I need to do to be 110%? And you open yourself up to possibility, anything is.
When it comes to brain disorders or any health challenges, having a miracle mindset is key. Up next, we'll talk about the 7 keys to an ultra mind. I'll take all the information we've learned in this docuseries and condense it into a comprehensive plan that you can start today, so that you can get one step closer to healing your broken brain. See you there.